An Indigenous community in Western Australia has vaccinated 76% of eligible residents in just 2 days. Leaders from the Warmun Aboriginal Community have attributed their success to local leadership and a strong relationship with medical professionals. Dr. Catherine Engelke is the Duty Medical Officer at Kununurra Hospital and she joins me now. Thank you so much for your time. How many people were you able to vaccinate and how did you do it?
Thank you, Karina. We were able to vaccinate 126 people on the first day, and then we vaccinated 56 people on the second day. Essentially, it was a two-part process. There was some health promotion from the Kimberley Public Health Unit came earlier in the week, and they started talking to the Aboriginal people about the COVID vaccine, and then I arrived with the rest of the team that were actually vaccinating, and RFDS delivered the COVID vaccine on the Thursday, Friday. And I think once the community knew that I was coming as well as a team, they relaxed. There was lots of conversations about COVID, about the vaccine, and the implication to not vaccinating to our community. So, we had a successful turnout. I'm very pleased.
I mean, it's such a remote area in that part of the East Kimberley. So Warmun is about 200 kilometres south of where you are in Kununurra. So what logistical challenges did that pose?
The transport of the COVID vaccine, it actually needs to be frozen. So it actually was transported by RFDS from Broome. So they had a freezer on board their plane. And so when they landed, there was education to the RAN nurses, the remote area nurses in Warmun, about how to mix and how to prepare the vaccine. And it was, a logistics about getting the elders of Warmun coming up. So they were transported to the clinic and then returning home, and the rest of the community that may or may not have transport.
You touched on it earlier. What about misinformation? We know it's an issue in the Indigenous community, as it is in the wider population, but conspiracy theories are rife about the implanting of chips via vaccines, things like that. How do you combat that misinformation?
With the correct information about what the COVID vaccine is and why we're doing it. So, there's a lot of, I agree, there's a lot of information and it's poor information and causing a lot of anxiety and unnecessary angst in the Aboriginal population and the wider community. So it's really about being very clear about our message. The vaccine is important. We have an obligation to each other and to our communities to actually protect each other. And we've got a small window of opportunity to actually be vaccinated and fully vaccinated before our communities actually have to see the COVID virus.
And how important is it for First Nations people to be vaccinated? I mean, the rates of vaccination, say in the Northern Territory, are much higher than in other states. And is that because there is a significant Indigenous population?
I think it may be, but also I think because of the continuity of health services. And so it's really about the Aboriginal community are anxious about this. And so they really need to be told the correct information about people who they trust and who visit them regularly. So, it may be because there's a large population, but it also may be because of continuity of healthcare services. So people going to the community regularly and the community members know us. So they trust us. And it's really important that we provide them with the correct information.
And that's been the case for you, hasn't it? I mean, you were born in Derby and raised in Halls Creek, so this is all very much your patch. How does it feel to be called an inspiration for your role in the community?
Look, I'm very inspiration. I think I'm just part of the community. Warmun is very important to us, to me, and the East Kimberley, having grown up here. And really, it's just my part in providing back to the community that has given me so much. So I've got a small role.
You said Warmun is very important to you. I think there's a painting behind you that's from a Warmun local.
Yeah, so it's my auntie. So Shirley Purdy is one of the elders in Warmun, and her daughter Madeline Purdy is the chair of the Warmun Council, and who actually has been this remarkable woman who's actually stood up and provided leadership and demonstrated her commitment to the community. And she was one of the first that rolled up into the clinic and said, I'm here to be vaccinated. So, that leadership has to be commended.
Yeah, leading from the front. Dr. Catherine Gelke, thank you so much for your time.
Thank you. Thanks, Karina.